Welcome and thanks for joining the Achieve Success in Autoimmune Disorders with Dr. Melina Roberts. My name is Heather Schofield and I'm the Education Director here at Biomed. I'm very thrilled that you're all here to join us, and I am especially excited and honored that Dr. Melina Roberts will be presenting on autoimmune conditions and disorders. A little bit about Dr. Roberts before we pass it over to her to get started. So Dr. Melina Roberts is a naturopath, and she's a leading authority and international lecturer on optimizing health from the microbiome and microenvironment all the way to complex chronic disease. She specializes in European biological medicine and treats conditions like women's health, mood and mental health, autoimmune disease, hormonal balancing, pediatrics, digestive disorders, chronic complex disease, and natural cancer treatments. Dr. Roberts has published the book called Building a Healthy Child and has articles published in the Clinical Journal of Sports Medicine, the Townsend Newsletter, Alive Magazine, Impact Magazine, and Amber Improved Magazine. She hosts a podcast on iTunes called Building Health with Dr. Melina Roberts and is ranked in the top 30 of naturopathic YouTube stations. She also blogs regularly and has lots of really cool speaking engagements, both online and in person once we're back in person. Okay, so with all of that said, I'm super excited that Dr. Melina Roberts is going to be talking on autoimmune disorders. We will hold all of our questions until the end, but feel free to type them into the chat room or into the Q&A section, and we'll make sure that we get all of that addressed towards the end of the presentation. And with that said, I would like to welcome Dr. Roberts.
All right. Thank you so much for being here. I appreciate you taking time out of your busy schedules attend this webinar, and I'm excited to talk about autoimmune disease because I see a lot of autoimmune diseases in my practice, and I'm excited to share with you my approach to treating it, which can, if you're a person who suffers from autoimmune diseases, then you realize that it's possible for you to heal from autoimmune disorders. And if you see patients who have any autoimmune conditions, that you'll feel confident, you'll come away from this confident that you'll be able to help them. So Heather did an excellent job in introducing me. This is just a little bit of background about me and my education. I am a graduate of the Canadian College of Naturopathic Medicine in Toronto. I did some extra training with the Paracelsus Clinic in European biological medicine. And that's really how my approach is. It's European biological medicine. That's what I do in my clinic, and that's how I practice. And I had that special training about 16 years ago now, and that's really how I approach things and how I see people. I always look at it through that lens of biological medicine. Now, here's just a short list of some autoimmune conditions, just to give you an idea of what all the different autoimmune conditions that there are out there. And I'd say that this list is some of the common stuff that I see in my practice. And this is also stuff that I deal with personally. Like I, as a kid who had bad eczema, and I also have celiac disease. So I've dealt with it personally, and I see it a lot in my practice. And I think one of the challenges with autoimmune disease is people are given a diagnosis of autoimmune disease, and they think that they are going to have this problem for the rest of their lives, and that there's nothing they can do about it, that this is what they're just going to have to suffer through. And the truth is that we can actually heal the body from autoimmune disease, that it doesn't have to be a life sentence. And I think that's really important to understand because, when patients come in to our clinics, into our practices, and they have this diagnosis and they just think, okay, well, how am I going to just manage the symptoms? And you realize that if we actually treat root causes here, that we can actually, in a sense, reverse or be able to heal the body from autoimmune diseases. So I think like that's so important for you to understand when you look, especially when you look at that list, for a lot of people, those are scary diagnoses to hear from their doctor. Now, how much autoimmune disease are we seeing in our population? And we see quite a bit. Just in the population, 1 in 5 people suffer from autoimmune disease at some point in their lifetime. That's 2 million in Canada. And I believe we have some people here from the US. So I'll give you some stats in the US, and that's more than 24 million people in the US suffer from autoimmune conditions. So we know that this is seen a lot and a serious problem. Now, how do we define autoimmune disease? Now, autoimmune disorders really have like one thing in common. You can just put them all together. And it's that mistaken identity where we have an we have an immune system that's triggered and it attacks itself and it causes inflammation and it causes tissue damage. It's the inability of the body to be able to decipher self from non-self. And that's what happens is that the body destroys its own tissues. So this is in essence what autoimmune disease is. And so lots of different conditions can just fall under that umbrella of autoimmune disease. Now, the conventional approach is that this is an immune system problem. So what we need to do is we need to shut off the immune system. And we need to do that in any way possible. So we need to suppress symptoms. We use immunosuppressant medications. There's also, like, I know that when I had eczema, you'd be putting topical steroid creams onto the skin in order to get rid of that skin rash. But like what the conventional approach is it's basically how do we shut off the immune system so that it stops attacking itself? And I'm going to talk about the biological medicine approach. Now, we see the immune system as very important. The immune system is that internal protection for our bodies. It's our defense mechanism. And our internal system, we need to be able to clearly be able to decipher self from non-self so that our body doesn't attack itself. Now, in an autoimmune picture, our body is fighting some sort of stressor that's causing chronic systemic inflammation. Now, there's different kinds of stressors. Some of those stressors can be food sensitivities, immune challenges, heavy metals, environmental toxins. And what happens is that those stressors will cause that immune system to elicit an immune reaction. And this will be a large reaction. So a lot of inflammation, a lot of what I call fire. So what we need to do, and then what happens is then the immune system is overloaded and it's just not able to function properly. So it loses that ability to properly decipher self from non-self. And that results in the body attacking its own tissues. Now, in autoimmune disease, like all autoimmune disease has that same biochemical process. It has a challenged immune system due to chronic inflammation. And if you learn anything, it's knowing that inflammation is the challenge with all chronic health issues. So we have chronic inflammation, and then that causes our body to not be able to properly decipher self from non-self. So in our biological medicine approach, what we're doing is we are identifying those stressors that are causing that inflammation, removing those stressors, and then healing the body from the damage from all that chronic inflammation, all of that fire that was happening within our system. And when we reduce that load on the immune system, we allow it to function better. And then what we also have to do is we then have to allow it to reprogram itself and then re-educating our immune system to properly be able to decipher self from non-self. Now, let's talk about this immune system because I think that this is really important to understand. And when I talk about the immune system, one of the main things I'm talking about is the lymphatic system. Now, the lymphatic system is made up of a network of different vessels and nodes. And how the lymphatic system moves is it moves when we move. It's not like the circulatory system where things kind of get pumped along. It has to move through our body's movement. And we have lymphatic tissue from head to toe, and we have concentrations of lymph nodes typically around joint spaces. And the lymphatic system is really cleaning up all of our tissues and then moving toxic loads out of our body. And what's interesting is that there is about 3 times more lymphatic fluid than we have blood in our body. And so where that lymphatic system starts, as you can see, it starts in that tonsils and adenoids. And what's crazy and interesting is that, like how many kids do we know get their tonsils and adenoids removed? And that's like getting a part of your immune system removed, because that's the first spot that the immune system will start to wake up when something's coming into the body. Then we have a large amount of lymph nodes and vessels throughout our neck. The next big spot is that thymus, and that thymus just sits right behind the breastbone, and it's a pretty interesting organ. It's releasing a lot of our immune cells, and it starts to grow up until about puberty, and then it starts to regress. Then as we continue, we have a large amount of lymph nodes in the axilla, so the armpits. And then we have our spleen. And anytime spleen shows up, to me, that's an immune process. And so the spleen is also a big part of the immune system. The spleen, it lies in that left upper abdomen there. And what it's doing is it's transforming those white blood cells into defense cells, and it's filtering out old blood cells like our red blood cells and our platelets, and it breaks them down. And that spleen is really like the largest lymph organ. And then if you go down, you'll see that we have that Byers patch, and that Byers patch is where it is it's actually sitting just right inside the mucous membranes of the cells that line the digestive tract. And it's a collection of immune cells called Byers patch. And they're part of a bigger part of something called the gut-associated lymphatic tissue. And these cells, what they're doing is they are looking at everything that's coming in through the mucous membranes of the digestive tract, and deciding whether it stays or whether it needs to be attacked and engulfed. And what's interesting, it probably is about within that gut space is probably about 70 to 80% of our immune system, which is a big part of that lymphatic system. And where another part of the lymphatic system, which in that immune system, which also is told that it is a useless part of us, and that we can easily remove it without it causing any problems to our immune system, is our appendix. And our appendix, what is shown is that it's actually rich lymphatic cells. So this is also a big part of our immune system, is that appendix. And then within that groin area, the inguinal area, we have a large amount of lymph nodes in there. And then our bone marrow is also part of that lymphatic system, part of that immune system. Now, gets into lots of details in terms of that immune system. But I think what's important to know is that we have kind of two parts of that immune system. We have an innate immune system and we have an acquired immune system. Now, innate immune system, I find it's the part of the immune system that really gets ignored, that a lot of people aren't talking about this innate immune system, and it's so important to how the immune system functions. So the innate immune system is the defenses we are born with. And the acquired immune system is how our immune system is educated as we go through life. Now, the acquired immune system probably gets a little bit more attention because that's where that's how vaccinations kind of work on that level of the immune system. But remember, we have an innate immune system that's also works really well if we take care of it. Now, I just want to go through and just explain to you just a little bit about how this immune system works. So one of the things that happens with our immune system is we have these things called macrophages. And these macrophages, they will see a pathogen that needs to basically be destroyed or needs to be removed from the body. And so what the body does is those macrophages first do is that they engulf it. And then what they do is they take little pieces of that pathogen and they put it on their cell membrane just to let the body know what it needs to be removing. And then what comes along is we have these T cells, and these T cells will basically bind on to where those little pieces of pathogen are, and they will then replicate all of those pieces. So then they are now looking for, now we create an army of these T cells that are all looking for this pathogen. Now, when these T cells see this pathogen, what they do is they create pro-inflammatory cytokines. So cytokines that are causing the breakdown of this pathogen. And then these cytokines, then what will also be produced is some anti-inflammatory cytokines, which is basically after you've broken down that pathogen, then the anti-inflammatory cytokines clean up the mess and move it out of our systems. So we need both pro-inflammatory and we need anti-inflammatory cytokines. So in terms of this inflammatory response with these cytokines, the cytokines see the pathogen and then break it down. So in order for this system to work really well, it needs to be a targeted system. So it needs to know exactly what it needs to break down if we have a well-functioning immune system. And if we have an insufficient inflammatory response, is that what will happen is that we won't be able to sufficiently break down that pathogen. And if we have an inflammatory response that is overstimulated, what can happen is that you can have a breakdown of the pathogen, but you can also have a breakdown of healthy cells. And this is often called a cytokine storm, but really it can also be called autoimmune disease because we're breaking down healthy cells. So in order for us to have a well-functioning immune system, we have to have cytokines that have a proper on-off switch. So we need to know when to use the pro-inflammatory cytokines and when to use the anti-inflammatory cytokines. And it also has to be targeted. So it has to know exactly what it needs to break down and what it needs to leave. So it's not touching any of those healthy cells. So when it comes down to it, it's really about having a balanced immune system. So we don't want it to be an immune system that overreacts, and we don't want an immune system that underreacts. And when we have an immune system that overreacts, that's when we start to see autoimmune problems. So often, people will ask me, you know, like how did my immune system become so bad? And one of the examples that come to mind is the idea of fevers. Now, what we need to realize is that fevers are a healthy immune response. What fevers are doing is they are producing an unsuitable environment for infections to be able to thrive. So it's our body's innate intelligence. But what tends to happen in our society is that when typically our children have a fever, we are suppressing that fever. So we are not allowing the body to run through that fever and allow the body to get rid of that infection on its own. We get really scared when the body has that fever, and instead we are giving people fever reducers. And when we are doing this, we are suppressing the immune system. So what happens over time is that, we have these kids and we just keep suppressing their immune system. And then when their body is trying to have some sort of healing response, potentially as an adult or later on in life, then their body just won't respond like it should. So what we need to be doing is, even as children, as nervous as it is, as a mother, I know how tough it is to watch your kid go through a fever. But what that fever is doing is it's helping to support that healing process. And when we do that, we help to strengthen the immune system. So what you need to realize is that when we suppress that healing process, we're weakening the immune system. So now these are the three components that you need in order for autoimmune disease to happen. And to me, learning this information, this slide right here, was a game changer for me in terms of how I treat autoimmune disease. So it's realizing that these three components have to be in place in order for autoimmune disease to happen. And when you know that, then you know what you need to be, you know what you have to be working on. Now, first of all, what needs to be, so this is basically the formula for someone to have autoimmune disease. They have to have a hyperpermeability of the gut. So they have to have those little holes in their digestive tract in order for us to have autoimmune pictures. We have to have an overload of toxins or an overload of stressors in the system. And then there also needs to be a genetic susceptibility. So, and this can basically, I think that we all have genetic weaknesses. And it's just a matter of whether those genetic weaknesses present themselves. So I blame very little on genetics, but I do think that we will have a genetic susceptibility if we, especially that's part of what I ask in terms of history of patients. You want to find out if any of their first degree relatives have any sort of autoimmune condition, and it can be anything. And then the other thing is whether this person in their lifetime has experienced an autoimmune condition. For example, I'll give myself, for example. So I had an autoimmune condition as a kid. So I had eczema as a kid, and then I have celiac disease as an adult. And that actually leaves me more susceptible to autoimmune pictures if I didn't do all of the cleaning up process. And I think that genetics is always a challenging point too. again, because I blame very little on genetics, but what you have to realize as well is that that you have to clean up the environment um, around cells in order for in order for you to even for that genetic picture to even present itself. So I think that's also really important to understand, is that it's more about that environment, that overload of toxins, that intestinal permeability that would allow that genetic picture to even be able to present itself. So it's not just about genetics. It's about having those other components too that would lead you to an autoimmune picture. So one of the first protective lines in the gut is the microbiome. And that microbiome is this ecosystem of bacteria and fungus that live within our gut. And it's really like one of the first line of defenses that really protect the lining of the digestive tract. And it's a dynamic entity. It's influenced by a number of different factors, and it can change, but it's hugely impacting how our system's functioning. And if we have a breakdown of this barrier system, then what can happen is that then we can get access to the lining of the digestive tract. And so this is where we can get a compromised gut wall. Now, what happens is that there's a lining of the digestive tract. It's just one cell deep, and what holds those cells together are called tight junctions. And if those tight junctions are injured, that means foods that are in the lumen of the digestive tract, or toxins or microorganisms or undigested foods, any of those things can be moving from the lumen of the digestive tract into the bloodstream. And what can happen is that when those substances that really shouldn't be in the bloodstream make their way into the bloodstream through that gut lining, they will actually elicit a whole immune response, and we will get an inflammatory cytokines. We will get a lot of inflammation happening in the area. And this is that chronic inflammation picture. And when we have that chronic inflammation in the bloodstream and an overload on the immune system, that just sets up a picture for an autoimmune picture. So all autoimmune pictures have this leaky gut or this hyperpermeability of the digestive tract. Now, what are some of the substances that can increase that intestinal permeability? So they can be foods. So there are a number of foods that actually shown to damage the tight junctions. Those can be things like gluten, cow's dairy, sugar, fructose, soy, peanuts, industrial oils. So all of those things can be damaging the lining of the digestive tract. We can have infectious agents. So everything from viruses, bacteria, fungus, parasites, dental foci. Got to remember that. So sometimes you can have some infections that are going on in the gum line, in the tooth, that we're not aware of, but that can definitely be causing problems in our system. And then there's a ton of environmental toxins that unfortunately are in a lot of our foods. So we get exposed to those environmental toxins. And some of those environmental toxins will also include the EMFs that are just around us, and it's tough for us to completely get away from. And heavy metals, also a toxic load that's tough for us to completely get away from. Mercury, the most common one I think of is the metal amalgams in the mouth. Lead, we used to see it everywhere, from in our paints to lead in the gasoline. And we will also see cadmium and arsenic and aluminum. So a lot of these heavy metals they're in our environment, and they're also ending up in our foods too, because they end up in our soils. There can be some mechanical stressors, which can be increasing that intestinal permeability. We don't really think of them, but structural imbalances can be causing that, as well as scars. And then there's also emotional stressors, and we know there's can be huge problems in terms of the gut brain connection and emotional stressors. We see an increase in cortisol, and we see that HPA axis dysregulation. So we see stressors, and you can't really separate if there's some emotional stressors that might be causing some of that intestinal permeability. So a lot of things can be causing that permeability. And so this is the approach. This is the approach that we need to address to healing this autoimmune picture. So first of all, we need to identify and remove all the things that are causing the inflammation. So I call this stage the putting out the fire. So identifying, removing. Then what we have to do is we have to work on healing the lining of the digestive tract that's been damaged. We know that with autoimmune conditions, all autoimmune conditions, that there's a hyperpermeability. We need to start rebuilding a healthy microbiome, so that ecosystem of bacteria and fungus that live within our gut. And we need to support the pathways of detoxification. So we have to make sure that the pathways of detoxification are open and able to effectively move toxic loads outside of the body. And then we have to reestablish and re-educate the immune system to be able to function properly. So here are some of the ways that we can be decreasing that inflammation. We can do it through, I'd say, first of all, you got to work on identifying what they are. So you got to, be cleaning up the diet. And I'm going to go into a lot more detail with the foods we should be eating, not just the ones we need to be removing. But there's lots of studies that are showing, gluten and cow's dairy and sugar and those fried foods are actually damaging those tight junctions. And then we know that those environmental toxins, that they're damaging those tight junctions. Heavy metals are, some of those infectious agents that shouldn't be in our gut are, or overgrowths that shouldn't be there. Some of those mechanical stressors and some of those emotional stressors. So we need to identify and remove what's causing that inflammation in our system. And I really think that, some people are a little bit more lenient, but I think that one of the reasons that I have high success rates in treating autoimmune disease is because I'm really strict on the diet, because I think that the diet changes need to occur if we want to heal the gut. Just having gluten or cow's dairy on occasion, we're still going to be causing inflammation in the gut. And it makes it tough for us to be able to heal the gut if we have these foods in our diet. And what we also want to be doing is trying to aim more towards organic foods, because then you're removing some of those toxic loads like the herbicides and the pesticides and the insecticides, and as well as any of the antibiotics that they've been injected with, or hormones that they've been injected with. And so if you look at that top picture is, you can see the cells are all stuck together, and this is a really inflamed picture. And what's challenging when these cells are all stuck together, what happens is that, this is the one at the bottom is where, what our cells should look like, where the cells are nicely spaced out. And when they're nicely spaced out, we can get proper oxygen and nutrients into those cells. And we can also move toxins and CO2 out of the cells appropriately. When those cells are all stuck together, which is what happens in an acidic environment, in an inflammatory environment, then it's really challenging to properly get nutrients into our cells. And what we need to do is, we can do it through diet, and it does take some time to change that milieu. But what we can also do is we can speed up the process by doing it with supplements. And you can do that with supplements like the Pleo Alcala or the basic tabs will help to alkalinize that environment so that we can start to get those cells to separate themselves. And then there's other products that can use. Once those cells are more separated, sometimes what can happen is that within those cells, because you're getting some anaerobic metabolism happening, you have a buildup of things like lactic acid inside the cells. And things like products like the Pleosanivus and the Pleocitro actually help to move that acidity out of the cells that are inside the cells. So this is just some tactics that we'll use in order to decrease that inflammation and get a more alkaline milieu. Now, one of the other problem foods for us is grains. And first of all, grains, as soon as we eat them, they will turn to sugars rapidly, and this leads to a huge insulin response. Another challenge with grains is that they can actually contain something called mycotoxins. So these are toxins that are produced by mold. And just by the way they're grown in the fields or the way that they're stored and processed, the grains can actually harbor these mycotoxins. And so then when we consume them, we end up consuming some of these mycotoxins. And another challenge with grains is something called lectins. And lectins are these proteins that are in plants that are basically defense mechanism of the plants. So it makes it so that animals won't want to eat these plants. But these lectins, when we try to consume them, sometimes they can be disruptive to our gut flora. And there is some evidence that shows that those lectins can actually also disrupt that microbiome and cause some damage to the tight junctions. So the truth is, and I know a lot of people don't like to hear this, but we can survive without grains. And that's one of the things that I suggest with my patients who have autoimmune pictures is removing grains from their diet. The other major problem food is cow's dairy. So this is the problem with cow's dairy is this protein in it called casein A1. And it's a large protein. It's designed for cows' digestive tracts, not our human digestive tracts. So when we take it in, we can't effectively break it down. The other challenges with cow's dairy is that there's hormones added to it. There's antibiotics added to it. There's a process that it goes through called pasteurization, which really just kills off anything that was beneficial in terms of bacteria. It denatures some enzymes. So as an end user, this is no longer a healthy food for us to be consuming. So there's lots of alternatives. We could be having organic grass-fed butter, goat or sheep dairy. We could have rice, almond, coconut, any of the nut milks. And what we also want to be avoiding is some of those all of these processed fats. So these processed oils, the corn oil, the canola oil, the cottonseed oil, the soybean oil, safflower oil, and sunflower oil. And then these anything that you pick up that says hydrogenated fats or partially hydrogenated oils, which really what they are typically is like a margarine, but they've been altered and changed, and they make it so it's really not natural and it's really not healthy for us to be consuming. So what we should be consuming is lots of healthy fats. So there's lots of things we could be consuming, from avocados, olives. There's a big list there for you. And then if we're having animal proteins, we want it to be grass-fed, grass-finished, or we want it to be wild. And there are some proteins that you want to be avoiding. You want to be avoiding a lot of those industrial meats. The industrial meats have been fed corn and grains. And what happens is that they end up being a a source of inflammation in our system. There's the processed meats like sausages and those lunch meats and hot dogs, which aren't really good proteins for us to be taking in. Farmed fish, just shown to have a high amount of toxic loads. So that means that when we're consuming them, we're also taking in that high amount of toxic loads. And I love seafood, so this one's a tough one for me to hear, but limiting seafood, just because the seafood can have a lot of toxic loads in it. And then, so the proteins that we should be consuming would be organic grass-fed meat, wild fish, wild game meat, some organic chicken and eggs. We want to have raw nuts and seeds, bone broth, collagen. Those are all great proteins to be consuming. And then in terms of carbohydrates, you say no grains and people say, oh, so I can't eat carbohydrates. But the thing is that, our vegetables are carbohydrates. So you want to be having lots of green vegetables. You can have these things called resistant starches. So this is one way where you can have your potatoes or your rice or your beans. And what happens is that when you when you take in some of these foods like some of those resistant starches, what happens is that, like, say you take white rice, what you do is you cook it, then you cool it, then you can reheat it again, or you can eat it cooled. But by going through that process, it becomes a resistant starch. And what that means is that it doesn't get digested into starches, like normal starches. Instead, it goes right into the intestines, and it actually is food for the healthy bacteria. Other things that we could be consuming would be things like seaweed. We could be consuming lots of herbs, lots of fermented foods. So there are lots of carbohydrates that we can be taking in. And then what we want to be doing is we want to be working on healing the lining of the digestive tract. And one of the things that we want to do is we want to be supplying the body with the building blocks to do that repair. And we can do that by consuming some healthy fats in our diet, realizing that all of our cell membranes are made up of fats, so we need to be giving it ample amounts. And the other thing that we can be doing is taking something called NAG, so N-acetylglucosamine. And what it's doing is it actually is shown to repair the tight junctions of the intestinal tract. So this is actually a really powerful supplement for healing the lining of the digestive tract. And then what we need to do is we need to work on building a healthy microbiome. So if the soil is healthy, then we can grow a really great garden. And that's what the microbiome is about. It's about cleaning up that healthy environment. So, the first stage when I'm saying, like, we need to make the clean up that terrain is what we're doing when we're removing a lot of those inflammatory foods, and we're trying to alkalinize the terrain. And then once that terrain is healthy, then we can start growing a nice healthy microbiome, which is a nice garden. And we can do that by taking a high quality probiotic. One of my favorites is the probiotic 7-in-1. It's a beautiful collection of probiotics that work really well to help rebuild that microbiome. And then what we can also be doing is we can be incorporating natural probiotics, and also taking some prebiotics. And prebiotics, what they are is they are just food for the healthy bacteria, so that the healthy bacteria can grow and flourish. And sometimes what we also need to be doing is we also need to be adding in things like the Pleoalb and the Pleobef if we're having some fungal overgrowth. So that just helps to balance out those microbiomes. The Pleobef and Pleoalb work really nicely because what we have in our gut is we have a normal amount of fungus in the gut. And if there's the right environment, then we get an overgrowth of that fungus. And what these remedies help to do is they just help to down regulate the overgrowths of fungus and bring them down to normal natural levels. And there's really like no other remedies out there that do the same thing as these Pleo-Alb and Pleo-Bef if you have those fungal overgrowths. And what we also need to be doing is we need to be opening up the pathways of detoxification. So we need to help to support to move those toxic loads out of the body. And so we need to be looking at those major organs of detoxification. So that's the liver and gallbladder, the kidneys, the colon, and the lymphatic system. And these are, the remedies I listed off are also some of my favorites that I use a lot in my practice. I think it's really important to understand these drainage remedies because they work differently than a lot of other supplements out there that say that they work well for the liver, the kidneys, or the colon, or the lymphatic system. Because what the drainage remedies are helping to do is they are helping to move toxic loads out of the area around those cells. So it's actually helping to clean up the terrain. And one of the challenges is that if you don't first clean up that terrain, if you don't first clean up the area around the cells, then what can happen is that you could be giving your body all the nutrition to support liver or kidneys, but you may not be able to get the nutrients into the cells if all of the area around the cells is filled with toxic loads. So this is, I know I've done whole lectures on cleaning up the detox pathways, but this is really important to understand. We need to support the pathways of detoxification and make sure that they're open and able to move that toxic load out. Because if they're not open, then toxic loads are actually staying within our system. And when they're staying within our system, they're not allowing these organ systems to function properly. But especially in terms of this autoimmune picture, the immune system or the lymphatic system is just getting congested. And so we need to move that toxic load out. We need to clean up that lymphatic system so then we can allow the immune system to actually function properly. And then the next step is that we need to reestablish the proper function of the immune system. And one of my favorite ways to do that is with some organotherapy that has some Byers patch in it, is the pleoribacin. And what's great about it is it actually has some of that Byers patch glandular in it. So it's helping to just re-educate that whole immune system to, once we've cleaned it up, now let's re-educate it to be able to function properly. So what it's doing is it's strengthening that innate immune system. It's helping to stimulate the T lymphocytes, and it's reestablishing a strong immune system. And yeah, I think that's good for that Byers patch. And one of the other remedies that we will use is the pleopine or the pleopin, and it's some spleen support. And the spleen is like it's like a large lymph node, and the spleen is really a huge part of the immune system. And so by supporting the spleen, you are really helping to strengthen the spleen and the lymphatics function. And it's actually helping if you are more susceptible to infections. So understanding what the spleen does can also help you to understand what that pleopin does, because what the spleen is doing is it's responsible for the movement of blood and fluids. It's one of the largest lymph nodes. The spleen is responsible for a number of immune processes. And it's a reservoir really for blood and a site for blood breakdown. And what it's doing is actually integrating the blood circulation and the lymphatic system. So it ensures that the blood is just constantly regenerating. So this is a very important part of the immune system. And then another remedy that works well in terms of reestablishing and re-educating the immune system is another glandular called pleotime. And that, what it is, it's a glandular of the thymus gland. And so it's doing some deep strengthening of the immune system and any sort of chronic immune systems, chronic immune conditions. I love that it has that thymus gland extract. The thymus gland, so it sits behind the breastbone, and it is growing until around puberty, and then it starts to regress. So what that pleothyme helps to do is it's actually helps to compensate for some deficits in the immune system, or some of those deficiencies that are happening that are leaving you more susceptible to more chronic infections. So it's helping that immune system by supplying it with some of that thymus glandular, some part of that immune system. And then another one that can really help to educate the entire immune system. And I love this visual because it shows how it's supporting every part of that immune system. And what it's doing is it's a phytotherapy, and it also has some thymus glandular in it. And what it's helping to do is it's helping to boost up the immune system, support that immune system. It also is helping to promote that lymphatic drainage. Now, it's nice comprehensive formula, and what it's helping to do is it's actually helping to balance out that immune system. So if there's any sort of deficiencies in the immune system, it helps to bring it up. And if we have a hypersensitive immune system, like we do in an autoimmune picture, it's helping to reduce that hyperreactivity of that immune system. So it's helping it to optimize that production of T cells, and it's normalizing any of those antibody responses. The immunoplex, what it also has in it is it has a herb in it called cleavers. And what that cleavers is it's the known lymphatic tonic, and so it helps to decongest that lymphatic system. So it actually helps to drain that lymphatic system, and when you clean up that lymphatic system, you actually allow that lymphatic system to be able to function properly. So this is just a summary of how we approach that autoimmune picture. We first need to decrease the inflammation. You need to put out the fire. You need to clean up the diet, and then we need to change that terrain. We need to alkalinize that terrain so that those cells are nicely separated. We need to then heal up the gut. We need to heal the lining of the digestive tract. All autoimmune pictures have a leaky gut picture, so you have to heal the lining of the digestive tract. And then a big part of that immune system is the microbiome, and we have to build a healthy microbiome. That's a big part of a strong immune system, is having a healthy microbiome. And then we need to make sure that we support the pathways of detoxification. We have to make sure that those toxic loads can effectively move out of the body, and so that they're not congesting up the system, so we can actually do the next step, which is reestablishing that proper function of the immune system. And we just re-educate that immune system when we can do those with different glandulars, different herbs that will help to support that immune system and get that immune system back functioning the way it should function, so that it can properly decipher self from non-self. So I think I got through with a little bit of time for questions. So thank you so much for listening. And if anyone needs to reach me, my email address is there. That's my website if you want to find out more about me. You can follow me on Instagram. I'm always posting lots of health information on there, or you can follow us on Facebook there. And thank you so much for your time. I hope you found this really useful, and thank you, Biomed, for inviting me to talk.
And of course, thank you for speaking to all of us. That was an absolutely amazing webinar. You covered off everything, so well, and I think really gave solid information on a very good approach to autoimmune disease and helping people heal from it. So thank you. The chat room and the Q&A section is on fire right now. So there's a whole bunch of questions that I would love if you're able to answer for us.
I will do my best.
Okay, sounds good. So some of these I have been sending some responses. And one of the things that came up, and it's actually, I think, a good thing to address, is about yogurt. And specifically cow yogurt or cow versus sheep or goat dairy, and what about organic cow dairy? And so I just reminded everybody in the Q&A section or in the chat room about the casein A1 protein, but it would be great if you could just talk about yogurt, and so cow organic, and then goat and dairy.
Okay, so the problem with cow's dairy is that protein in it called casein A1, and that protein is an inflammatory part of the cow's dairy that is really not beneficial for any humans to be consuming, which I know a lot of people hate to hear, but that's the truth. So I would say no cow's dairy, but what you can have as a replacement would be goat or sheep. And the reason for that is that the goat and sheep do have casein in it, but it's a smaller protein. So it's easier for our bodies to be able to break down and metabolize. There's also, if people are really big yogurt fans, there's almond yogurt, there's coconut yogurt. So there are options for different yogurts. In terms of organic, it does make it better. So there's less toxic loads, but the organic dairy still contains the casein A1, and that is the inflammatory part of the cow's dairy. A question I typically get asked after that is that now we're actually starting to see them come out with the casein A2 cow's dairy, which is a different cow, a different species. And from what we can see in the research, it is showing that the casein A2, that if you're able to get access to it, and I would suggest it more in an organic form, isn't showing to be inflammatory. So that might be good news for the dairy eating people.
Great, thank you. Okay, so next question, and this is one of the first ones that came through, and it's just a question regarding chronic fatigue and fibromyalgia. So Dave asks, is chronic fatigue syndrome generally grouped with fibromyalgia and or other autoimmune conditions?
Yes, yeah, they are. Yeah, it's I'd say that chronic fatigue syndrome is just a little bit tougher to diagnose because you're not specifically getting like antibodies with it. So it's based on some symptoms and some pain spots as well. But because it doesn't have specifically antibodies, it's still not diagnosed as frequently, but it's definitely, I would say, falls into that autoimmune picture. And that I would say that if you follow the protocol that I was talking about, you're able to get a lot of those people who are stuck in kind of that chronic fatigue picture, help to get them out of it.
Great, thank you. I'm sure that through this last year of stress, we're going to be seeing more and more autoimmune pictures showing up in our practices.
Yeah, and unfortunately, I think that's the case.
Hmm. Um, so there's another question that came in regarding pleoalb and pleopef. And so the specific question I answered from Dalton, but what I just wanted to ask in general was about, for those two remedies, do you have a differentiator when you decide on one versus the other, or what would flag you to be thinking of one versus the other?
Honestly, I test for it to see which one is going to work better for a patient. So um, I do some testing. I do some electrodermal screening, and I also do some muscle testing. So it allows me to figure out exactly which remedy the patient needs. So that's how I do it in my practice. I usually will grab both of them and test them both.
Okay, that's a good question. That's a good answer. um, I did have somebody else that asked about where to learn more about the actual pleosanum remedies. And we do on our website, we have an online course, a Sanum online course. And then we also have a series of 2 webinars that details every single Sanum remedy that's available in Canada and the United States. And so I can make those links available for anybody that wants to learn more. You're welcome always to call me here at Biomed, and I can do some one-on-one Sanum training over video or over the phone. And I'm happy to detail all of it. For pleoalb and pleopef, pleopef tends to be a species, a candida species that lives more in the orifices, in the mouth specifically. So if you're trying to just go by symptoms and you're looking at gum or tissue or teeth issues, less severe fungal overgrowth, cradle cap thrush, and things like that. And then pleoalb tends to be, it's Candida albicans, so it's a bit more systemic in the body. So you're going to see more gut symptoms like gas and bloating. You can see a white coating on the tongue. There could be reoccurring yeast infections, skin rashes, nail fungus, or athlete's foot. So you can see pleoalb definitely has a bigger symptom picture that can sometimes flag you into thinking about it. Okay, so next question from Linda. Do you usually do all these steps in order, so for your 5 steps, or do you do it all at the same time? And then if you do it in order, is there any clue as to when to move to the next step?
I actually probably don't do them in order. I will mix and match them based on what the patient needs. I will definitely work with diet as a first step, and then I will usually also get them onto a probiotic, and then I will also so my starting point is usually a clean up the diet, get them on a probiotic, get them on to which organ system is showing to be at a weak state, and then I also may depending on how their system's looking, if I can even just start doing some some healing of the lining of their digestive tract. So that'll usually be my first step. And then I do a lot of testing within my practice. So I'm doing, I showed a picture of that dark field microscopy, but you typically run that dark field microscopy. So that gives me an idea of what that terrain looks like. And then I'll do some other testing to figure out what those stressors are on the body. So that kind of, for me, that's what guides me to how I'm going to progress. Am I going to work on the liver or the kidneys or the gallbladder, or I'm going to work on the lymphatic system? So hopefully that sort of helps you to guide you. But I do sort of, I guess, I don't go in a specific order. I just keep all of those things in mind, that all of those areas need to be worked on.
Excellent. And then for that last part, you're reestablishing the proper function of the immune system. Is that also interspersed in what you're doing, or does that come a little bit later once you've diet, healed the gut lining, started to strengthen the organ weaknesses, and starting to remove the stressors?
Yeah, it typically comes a little bit later, but maybe even on that second visit, I typically see my patients once a month. And then typically on that second visit, I may introduce like a pleorebus. So as early as the second visit, but usually not the first. So a little bit later. But yeah, once things are cleaned up, then we can
Okay,
start educating that immune system.
excellent. Okay, next question. I don't know if I missed it, but when you were talking about some of the other foods to eat, where does quinoa, hemp, and chia seeds fit into the mix?
So, um, so I would put quinoa under the grains category. So unfortunately, I typically will remove it. I would say that it's not necessarily a forever thing, especially with something like quinoa, but it's still a grain that would turn to sugars right away. And then chia seeds will fall under fats. So especially for patients who kind of miss their cereals, I will get them to put together like a chia and flax seeds in order to kind of make up a cereal of sorts and with some nuts and seeds. So that it kind of seems like a cereal, even though there's no grains. So it falls under fats, healthy fats.
Okay, excellent. And what about hemp?
Hemp also falls under fats.
Into fats. Okay, great. Thank you for that
Yeah,
clarification.
yeah.
Okay, so we've got a couple more questions here. And so regarding the pleothyme or thymus glandular, can you please explain if pleothyme is contraindicated for autoimmune, as we do not want to boost the immune system?
Yeah, I should talk about that whole concept because I actually, in a sense, disagree with that whole concept. Because I think that that's what people kind of get scared of, that you don't want to be boosting the immune system. But what we actually are trying to do is we want to we want to be removing all of those things that would be causing inflammation, and then we do need to re-educate that immune system. So in some cases that immune system needs to be toned down, and in some cases it needs to be reestablished and brought back up. And so it's that balancing point. So it's actually okay to like once I guess the groundwork is put in, it's actually okay to help to build up that immune system, and sometimes that is a boosting of the immune system. So I think that sometimes like we got to be really careful, but like you don't want to be doing that right at the beginning of therapies. You want to be cleaning things up first, but don't be too nervous about bolstering that immune system, because like I would say that like I look at people's blood underneath the microscope, and there'll be some people who have autoimmune conditions, and their immune cells are actually functioning quite well. And then there's some people and their immune system, you can see that it's really depressed, and those people, even with that autoimmune picture, do need their immune system to be strengthened. So you really just have to see where the patient's at. You're not going to be doing that right at the beginning, but don't be too nervous about the when something says boost the immune system and you're working with an autoimmune picture. I think that's a good clarification to be able to make.
Yeah, absolutely. I know in biological medicine and a lot of the teachings that come from Dr. Thomas Rao and the Paracelsus Clinic, um, they're not always talking about boosting or stimulating the immune system, but instead modulating the immune system.
Yeah.
And I think in what you're talking about, it is like that re-education or that reestablishing and modulating. So it's not going in and trying to push the immune system to create a response, but instead getting the immune system back up so it can mount a healthy response when necessary.
Yes. Perfect. Yeah.
Yeah. And the other thing always in all the Pleosan and protocols and biological medicine from Dr. Rao and Dr. Wortman, and as you also said, Dr. Roberts, that you do your work first and you put the foundation and you build them up and you clean them up before you start working on the actual immune system. So getting that groundwork done so the person then can actually mount a healthy immune response as necessary.
Yeah, exactly.
Okay, so we've got a couple more questions here. Any contraindications for the types of recommendations you've made that practitioners should be aware of?
Well, I think that, you think of those contraindications, like some of the things is that um, you have to make sure that those, or I know I have it as my fourth thing, but you have to make sure organs of detoxification are open and moving. In order to get any of this to work, right? Because if we have, for example, if you have someone who's constipation and they're just really like your bowels or your body's way of moving toxic loads out of your body, and if they are constipated, then you really have to work on getting those bowels moving before we can get any of this out working, because they're without that, then we can't effectively move toxic loads out of their system. So yeah, I would say that that would sometimes be a challenge point to why patients are getting worse, is that those organs of detoxification aren't moving effectively. So then so people are just ending up being more toxic, and we're not effectively moving those out. Try to think of other contraindications. Yeah, I think that it's just being mindful. I think that to me that would be the biggest one. I don't know if Heather, you have any that you can think of as well, off the top of your head, but yeah, to me when I look at that whole plan, making sure organs of detoxification are moving is pretty important to making sure that whole system works well and starts to heal.
Yeah, I think that that's the biggest thing to be always keeping in mind as a practitioner doing this kind of work. As you said, you need to be able to move the toxic load out of the system. And if the detox pathways aren't open, so the bowels, the liver, the kidneys, the lungs, then you can just get things recirculating in. And then that's where you can see the healing reactions and the healing crises happening. So
Yeah.
being mindful of some of the specific steps. There is one other thing, just generally, the product NAG or N-acetylglucosamine, it is derived from shellfish. So if somebody has a shellfish allergy, then NAG is not the remedy for them.
Okay, good. Yeah.
That is on the label. So it is under the contraindications on the actual label as well.
Cool.
Okay, so we've got a few more questions here. Oh yeah, Dr. Wales also said shellfish and NAG are shellfish derived. So thank you, Dr. Wales. Okay, so can you use this approach for also treating food or environmental allergies? And Philip also says, thank you for a great lecture.
Thanks. Yeah, I would say that you can use this approach for allergies as well, in food sensitivities. Yeah, it's really an approach for a big one for healing up the gut and re-educating that immune system, cleaning up that terrain, balancing out that microbiome, right? All of that is going to help the body to function better. So, and when we get a body that functions better, then we can set up the environment to allow it to heal, which is really the essence of what biological medicine is all about.
Mm-hmm. Excellent. If you've listened to many of Dr. Roberts' talks, you'll find that there's some common themes because the biological approach, as what she practices, has a lot of the same things in what you're doing. Okay, so we've got just a couple more questions here. And if you have a patient that has a severe anaphylaxis reaction to dairy, what do you do if a product contains lactose? It's even though it's a sugar, would you still be also cautious about giving that?
I think you're talking about like homeopathics, right? And because a lot of them
Yeah, yeah, the
are on the base, the base of them is lactose. And
yes.
like honestly, from my experience, I haven't had even people who have some severe allergies to cow's dairy. I haven't seen them have severe reactions to like the homeopathics with the lactose base. So I would do it cautiously, but I sometimes if a remedy can, if that's the only way it comes in, if it only comes as a homeopathic on lactose pills, then I would still likely use it.
Okay, excellent.
Yeah.
Um, okay, so just a couple more here, and I'm just trying to be very cognizant of time. Um, so, have you ever seen chronic low white blood cell count with blood tests and dark field with autoimmune overstimulation? This might be a question that can be taken outside of this webinar if it's a bit too complex.
Yeah. So yes, I have. But I also treat a lot of cancer patients in my practice too, and so often we will see that chronic low immune system, and both I'll see it in the blood, and we'll see it in the blood work as well as in the dark field microscopy. And yeah, a lot of that is re-educating the immune system. And with my cancer patients, one of the things that I will use when I see that is a mistletoe injections, and that really helps to boost up a really depressed immune system. Um, I honestly haven't used it that much in autoimmune pictures, but I would imagine if it was really depressed that it would be one way to modulate the immune system.
Okay, thank you. One last question here. I do have somebody asking just about good dark field training, so I'll send a link regarding that for everybody.
Okay.
And so we do have somebody in Canada that does a really great job in Toronto area. Okay, finally, for someone who has peptic dyspepsia, an autoimmune disease, having a hard time digesting any types of protein, digestive enzymes don't seem to work, and usually on a carb diet for digestion, what kind of approach would you have, or what kind of recommendation would you make?
I would think about using like proteolytic enzymes of some sort. Um, I think that would be a case in terms of helping the body to break down those proteins, because it is really important to get those proteins. Your body needs those amino acids as building blocks. We need those fats as building blocks too. And so I would think about incorporating some type of proteolytic enzymes into the plan in order to get stimulate some proper digestion.
Okay, good suggestion. Plus, sometimes acid-base balance or alkalizing, since it does support the kidney or the stomach, the pancreas, and the liver,
Yeah.
in addition to those enzymes.
Yeah.
Great. Okie dokie. So I've got two last quick things, and then we'll close off the Q&A. Do you recommend removing gluten-free oats because it's a grain or potential grain?
Yeah, so in an autoimmune picture, I do take out all grains, including oats.
Okay, perfect. Thank you. And substitute with chia seeds and flax and nuts and seeds to make cereal.
Yes, exactly. If you want to make a
Perfect.
cereal. Yeah.
Okay, excellent. And then the last question is, how long do you work with individuals on average?
Like how long till we get results, or I don't necessarily understand that question.
I think it's more like when you're seeing patients, like how many times are you seeing them? And, oh yeah, I
Yeah.
guess results too.
Okay. So yeah. So I'm typically seeing patients once a month, um, and I would I I would be expecting to see results within 3 to 6 months. They might not be completely better by then, but we want to make sure that they're improving at those junctions. Does that
Okay,
hopefully that
perfect.
answers? Yeah.
Yeah, exactly. So great. Okay, so that's it for questions and inquiries and wanting to learn more. And so I want to thank everyone for joining in on the webinar to learn more about Dr. Roberts and also biological medicine approach with autoimmune disorders. Dr. Roberts, thank you so much for sharing your experience and your wisdom with all of us, and also for sharing a plan that's actually fairly straightforward and something that's quite achievable by learning and understanding how to actually put it all together. And it's nice that it's something that is within reach of all practitioners.
For
So yeah,
sure.
so
Like
thank you
it.
so much.
Yeah. Yeah. No problem.
All right, any parting words for us all?
I think it's important to, I said it in the talk, but I think it's important to know that, like, to not be intimidated by treating autoimmune disease and realize that that it is a treatable condition and that it's actually like a reversible condition. I've seen a number of patients fully recover from autoimmune pictures to a stage where they no longer have the antibodies, that their systems function quite well. I would say in a lot of cases, their diet needs to remain quite clean, but beyond that, they're living a fairly happy, healthy life. So I think that's what's really important to understand, is that don't be intimidated by the autoimmune pictures, that they're fixable and treatable.
Mm-hmm. Exactly, not a life sentence.
Yes, exactly.
Great. So thank you, everyone. Thanks for joining us tonight. Thanks for joining Biomed, and thanks for joining Dr. Robert. So thank you, everyone, and have a really wonderful rest of your evening and rest of your week. Take care.